Welcome to Scanning Preparations for Veneers, powered by iTero Element Intraoral Scanner. Scanning veneers requires 4 steps: scanning preparations or preparation segments, scanning preparation arch, scanning opposing arch, scanning the bite. Scanning the preparation segments. The iTero Element Scanner default settings are configured to scan the most posterior prep tooth in the left quadrant, moving forward up to the midline. The scanner then transitions to the most posterior prep tooth in the right quadrant as shown in this diagram. In our case, the first prepared tooth is the upper left first premolar. Confirm that the tooth you are scanning is labeled correctly in the window above the viewfinder. Center the tooth in the green crosshairs of the viewfinder. The iTero sleeve is the retraction device used to retract the lips. Once you tap the scan icon on the screen, the wand is in scan mode. Wait 10 seconds to allow for defogging and place the wand tip on the occlusal surface of the preparation. Note the green crosshairs in the viewfinder. Center the tooth and make sure the complete margin is visible. Press one of the side buttons to start scanning. Once the occlusal surface view is captured, while continuing to touch the surface of the tooth, roll the wand slightly lingually to capture the palatal surface. Roll the wand back over the occlusal surface onto the buccal, keeping the wand horizontal to the teeth to capture the buccal anatomy. Place the wand at the occlusal area and twist in a mesial and distal direction to capture the interproximal walls. Repeat the process to scan the remaining preparations in this quadrant from the upper left canine to the upper central incisor. Tap the directional area to move to the next tooth. Keep in mind that as soon as you capture the central upper left incisor and move to the next preparation, the scanner will prompt you to scan the upper right first premolar. Repeat the process to scan the remaining preparations. Scanning preparation arch. In this segment, we will scan the arch quadrant that contains the preparations. Make sure you've tapped the arrow and are in the correct segment. Place the wand on the most posterior tooth. Activate the wand, moving forward across the occlusal surface. When you reach the bicuspid, continue by moving across the anterior, tilting slightly to the lingual at the contralateral bicuspid, and then proceed by moving the tip straight back to the contralateral terminal molar to complete the occlusal surface. Roll to the palatal surface and lift the cord end of the wand to tilt the wand vertically, which shows the long axis of the teeth. This allows you to twist the wand slightly back and forth as you move forward, capturing the interproximal anatomy of the palatal surface. Next, roll back over the occlusal to start scanning the buccal area, keeping the wand horizontal at a 45-degree angle. The lens should remain in contact with the buccal cusps and incisal border of all the teeth in the quadrant. Stop at the midline. Repeat the process on the contralateral side. Scan the opposing arch. Tap the directional arrows on the touchscreen. Place the wand on the most posterior tooth of the lower arch. Turn on the wand and scan the occlusal surface of the lower arch in a single continuous motion. When you reach the bicuspid, continue by swiping across the anterior, tilting slightly to the lingual at the contralateral bicuspid, and then proceed by moving the tip straight back to the contralateral terminal molar. Roll to the lingual area and lift the cord end of the wand to tilt the wand vertically and show the long axis of the teeth. This allows you to twist the wand slightly back and forth as you move back toward the posterior and capture the interproximal anatomy of the lingual surface. When you have completed the lingual, rotate to the buccal and use a rocking motion as you move toward the anterior to capture the interproximal anatomy of the buccal. Review the arch scan and check that all opposing arch anatomy has been captured. The bite registration is the last segment and is essential for proper occlusion. Tap the directional arrows on the touchscreen. To capture the bite, it's recommended to sit the patient in an upright position. Retract the cheek with the sleeve and insert the wand parallel to the buccal aspects of the teeth. Hold the sleeve with 2 fingers. Activate the wand and move it slightly up and down in a wave motion to capture the occluding teeth and the gingiva of at least 3 teeth. Repeat on the contralateral side. At this point, the scan is complete, and you can return to any section of the scan by selecting it in the menu. Tap the View mode. It starts with iTero.